Hi, I'm Dr. Jennifer McLeland with Vivi Women's Health, and I've been in the field of obstetrics and gynecology for the last 10 years. I'm here to answer some of your most common pregnancy questions, and I hope this will help you have a happy and healthy pregnancy. One of the first questions that I think everybody has but doesn't get to ask before they come to the doctor is, what will my first visit when I become pregnant look like at my doctor's office? And it can be a kind of long visit. So the first visit when you come to see us after you have a positive pregnancy test is probably going to involve a lot of paperwork and a lot of questions about your medical and surgical history, and may actually include questions about your husband's health history. So if you can have those answers prepared, it may make that visit a little bit easier. The visit will also include a physical exam, which will probably include a pelvic examination, so just be prepared, and an ultrasound to see how far along you are in your pregnancy. A lot of people expect for that ultrasound to be on the belly or abdominal, but most of the time that ultrasound is actually transvaginal because the baby is so very small early in pregnancy that we can't quite see what we need to see using an abdominal ultrasound. So also be prepared for that. It doesn't hurt, but it is a weird sensation. The last part of the visit will probably include a question and answer session with your obstetrician and a whole lot of blood work. So make sure you drink water before your visit and you're prepared to have your blood drawn. One of the other questions that I have often in pregnancy is what to expect as far as morning sickness goes. And one of the fallacies of calling it morning sickness is that it often doesn't only happen in the morning. You can have sickness at any time during the day. It's just that it's more common early in the morning, probably because your stomach is completely empty. So something to think about is keeping small, light, bland snacks with you at all times, like pretzels or crackers, and making sure you're always sipping on fluids. Those things can help with morning sickness. If you find that you're vomiting or you're sick all day long and it's making it difficult to get fluids and food in, then you should probably call your doctor to see if you need medications or even if you need to get some IV fluids with your physician. The next question that I get a lot is, what can I eat and what can I not eat? And as far as what you can eat, we want you to eat as normally as possible, and you don't need to eat for two. So you only need a few hundred extra calories a day when you're pregnant, unless you're pregnant with multiples, in which case you should follow the dietary recommendations that were given to you by your physician and your high-risk physician. But when you're pregnant with just one, you probably don't need all that much extra, but we like you to get a nice, well-balanced diet. And there are only a few foods that you actually have to avoid. One of those things are soft cheeses that aren't pasteurized, or actually any unpasteurized dairy products. Most of the things that you buy at the grocery store are pasteurized, but there are some soft cheeses, especially international cheeses, that are not pasteurized, and those aren't safe in pregnancy. Something else that's not safe in pregnancy is deli meat. It can carry a type of bacteria that can be harmful to you and your baby, so we like you to avoid deli meat. If you want to eat deli meat on a sandwich, for instance, you need to heat up the deli meat for at least 30 seconds until it is hot and sizzling. So most people don't do that regularly with deli meat. So that is something to keep in mind. Other things that you need to avoid are high mercury fish like tuna or tilefish or swordfish. Um, Also, being cautious about anything that isn't completely cooked, like raw batter, raw dough, raw meats, raw fishes. You're going to be more susceptible in pregnancy to those types of bacteria that can cause sickness. So please avoid those things as well. If you have any specific foods that you're not sure about, always ask your physician before eating them. One of the other questions that I get a lot in pregnancy is, when do I have to stop working or can I continue to work through my whole pregnancy? And the answer is, for most people, you can work right up until you deliver if you choose. Depending on what kind of work that you do. If you travel, especially by plane for work, a lot of airlines do limit your travel in the last trimester. Um, and we also like you to be relatively close to home as you progress further in your pregnancy. Now, there are some jobs that are physically strenuous and can be difficult to do as you get further along, and you should have that conversation with your physician about when or if you should stop working prior to your due date. Another question that I get a lot in pregnancy is, can I still exercise? And the answer is overwhelmingly yes. We want you to exercise. We want you to keep your body moving in pregnancy because it can lead to a healthier pregnancy and an easier delivery for you. The caveat is that if you did not exercise prior to pregnancy, that you shouldn't really pick up anything new and difficult while you're pregnant. This is not the time to start a completely new exercise program. If you are relatively sedentary prior to pregnancy, then something like light walking or yoga would be good to try while pregnant, but you probably don't need to start classes that are more strenuous or more strenuous exercise equipment that you're not familiar with. One thing to keep in mind during pregnancy is that contact sports or sports where your belly could be exposed to being hit are going to be things we're going to want you to avoid after you get out of the first trimester. You're also going to want to watch your balance with exercise, because as you become more pregnant, your center of gravity is going to shift forward. So exercises that you previously have been able to do might become more difficult. So I always caution my runners to not run on hills or loose gravel as they become more pregnant if they find that their balance is altered. Also, things like jumping and box jumps, trampolines, those should be avoided in pregnancy as well. But if you have any specific questions about the exercises you're doing, make sure you ask your doctor to see if they are in agreement with your current exercise plan. But again, we want you to keep moving while you're pregnant. We just don't want you to start anything brand new when you find out that you're pregnant. One of the big questions that everybody's really excited to find out when they're pregnant is, when am I going to find out my baby's sex? And that question is going to be different for everybody because it depends a lot on what your choices during the pregnancy are. So one way you can find out in the first trimester is via a blood test called non-invasive prenatal screening. That blood test was originally intended for genetic screening. It tests for things like Down syndrome, trisomy 13, and trisomy 18, but as an added bonus can tell us the baby's sex. That blood test can be drawn as early as 10 weeks, with the results coming about 2 weeks after the blood test is drawn. However, not everybody needs this test, and for some people, insurance coverage will vary. So you may or may not be eligible for this test, but it is an option that you should discuss with your physician. The other way we can find out your baby's sex is via ultrasound. This is generally performed between 18 and 20 weeks. So you do have to wait a little bit longer for this one, but this is where you'll find the pictures to find out if the baby is a boy or a girl. This is an exciting way to find out the baby's sex, but it is difficult to wait. Everybody always asks if they can find out earlier. Sometimes your baby cooperates a little bit earlier, but not all babies will show us on ultrasound their sex prior to 18 weeks or so. One of the questions I get a lot from new moms is, am I going to have to alter my skincare routine or the cosmetics that I'm using? And the short answer is not a whole lot. There are some things that we don't want you to use in pregnancy, mostly vitamin A derivatives like retinol or Accutane. So if you use any of those, please discuss with your doctor and stop immediately. However, most topical skincare is just fine in pregnancy. if you have a specific concern, you can bring your product to your physician so that they can see it and see if it's safe. It's very difficult sometimes when people don't bring the product because we don't know what's in it. But generally speaking, most topical skincare is safe. We do try to avoid really strong acids or peels while we're pregnant, as your skin sensitivity can change and you may notice more of a reaction following those treatments. Another question that I get a lot is it safe to use sunscreen? And the answer is yes, yes, yes. Please use sunscreen when you're pregnant. Your skin is actually going to be more light sensitive when you're pregnant. And so it is very important to use sunscreen, as you might find that you burn easier when you're pregnant versus when you're not pregnant. We typically like mineral sunscreens better than chemical sunscreens, but use whatever you are going to be able to reapply as indicated on the back of your sunscreen bottle, and one that you like and that works with your skin. Another question that I get a lot is about bug spray, especially here in Texas. And the answer is we like you to use bug spray because there are some diseases that are carried by mosquitoes that can be dangerous for you both while you're pregnant and while you're not pregnant. So in the summertime, if you find that you're going to be out during peak mosquito times, dawn and dusk, or you're going to be around standing bodies of water, we do advise that you use bug spray, and you can use bug spray that contains DEET. Another question that I get a lot in pregnancy is, can I dye my hair? And this answer is not as easy because there's very little research about hair dye or things like nail polish or perms in pregnancy. However, for the most part, these things are considered safe as long as you're in a well-ventilated area. The other thing to keep in mind is to try to limit these as much as possible. So maybe not doing it as frequently as you have in the past would be something to think about while you're pregnant. A big question that I get during pregnancy, and this is one of the hardest ones for us, is will my doctor be the one to deliver my baby? And the short answer is maybe. We try our absolute best to be there for you when the big day comes, but sometimes we can't be there. And that's why when choosing a physician, you need to think about the whole group and not just the doctor that you've chosen. So one thing to ask your doctor is how their call schedule works. Do they typically deliver babies on weekdays during the day? You know, are there males or females in their call group? And how in general it works. Most physicians are in a call group now, and so you may not be delivered by your doctor if it happens in the middle of the night or on a weekend. The thing to keep in mind is that your doctor also sometimes leaves town or sometimes was up all night the night before and is not the best person in that moment to deliver your baby. And they trust their partners to deliver your baby, and so you should too. Most of the time, we do our absolute best to be there for our patients, but sometimes we just can't. So this is a question to ask your doctor, and you should be comfortable with all of their partners if that time comes and your doctor doesn't get to be there. The last thing I was going to talk about today is a question that I get a lot, and it's, do I need a birth plan? And the answer is maybe. Depends a lot on what your preferences for the day of delivery are. That's something you should talk to your doctor about, especially if there's something that you think is really important to that day and you want to make sure it happens if it's safe. Your doctor may do a lot of the things that you were thinking about putting on your birth plan, which is why I say to talk to your doctor before you make one. There are a lot of things that used to not be standard of care, and now we do them routinely if it's safe. The things that you may want to look into are alternative pain options if you're not thinking about an epidural, are whether or not you want to be able to move around during labor and delivery, whether or not you want to be able to sip on fluids, whether or not you want a birth support person like a doula in the room, whether or not you want certain music playing or you want maybe a certain scent diffused in the room. These are all things that you can talk about with your physician. And most of the time, the things that patients want on their birth plan sheets are things that we are happy to accommodate. The only time we don't accommodate things on a birth plan are if we don't think that they're safe. But the biggest thing is to have this conversation with your doctor, because I think we want as much as we can to give you the birth experience that you desire, but we want you and baby to also be safe. So these are things to think about when you and your doctor have this birth plan conversation. I encourage all of my patients to bring up birth preferences by the middle of pregnancy if you think there's something that's going to be very important to you during delivery so that we have time to plan accordingly. As far as common pregnancy questions go, I know that for people, it's so easy to get on the internet and we have our phones in our hands all the time, and there are so many sources that you can find online. But I really encourage you to get your questions answered by your doctor. I always joke with my patients that Google does not make the best doctor, and I firmly believe that. I think that there are a lot of pregnancy forums online that are getting their answers from resources that aren't reputable. And I find my patients coming into my office scared because of the questions that they had and the answers that they found online. Your doctor is not going to be annoyed or bothered by your questions. Of course, if it's not an emergency, don't call in the middle of the night with a random question. But most of our medical assistants or our nurses or ourselves are happy to answer any questions that you have. And we would rather you get your answers from us versus Google. So please, please, please remember to ask your doctor your questions. We would rather be the ones to answer them for you. We hope that you have a happy and healthy pregnancy. And if you ever need anything from us, you can always call and make an appointment with Vivi Women's Health. Thanks so much.